Hello everyone, you're watching sqadia.com and I am Hammad Haider. Today our topic is fractures of the forearm and around the elbow joint. We'll be discussing the five topics around it. The first and foremost would be the lateral condyle fractures, especially how to manage the lateral condyle fractures in children. We'll be discussing the mechanism of injury, its pathology, clinical features, what to see on x-rays and how to treat it, and what are the different associated complications with lateral condyle fractures. In the second, we'll be briefly going through the medial epicondyle fractures along with the medial condyle fractures as well, and we're going through the mechanism of injury, pathology, what is medial epicondyle apophysitis, and fractures around the medial condyle. The next section will be dealing with the fractures of the distal humerus, which is actually the distal humeral avulsion fractures, especially of the cartilage. We'll be going through this x-rays and treatment and how to actually diagnose them, because this is quite a common injury, especially which is missed. And fracture we'll be discussing in the same section briefly the fractures of neck of radius and subluxation of the radial head as well. What are its treatment and how to treat these fractures, and especially in the case of children. The fourth section will be going through the radius and ulnar shaft fracture. We will be discussing what is the treatment in case of the children and especially in the case of adults when we have both forearm bone fractures. Lastly, in the last section, we will be discussing the two very important fracture types, which is one is the Monteggia fracture, that is involving the proximal ulna as well as the proximal radioulnar joint. And this next we'll be discussing the Gleazy fracture, which is actually the fracture of the distal radius along with the distal radioulnar joint as well. Thank you very much. Keep watching sqadia.com.